Bismillahirrahmanirrahim. Limb for Life is a initiative, healthcare initiative by Ferozans. My name is Dr. Ahmed Saeed Qureshi. I am consultant physician in Rawalpindi. It's a overall 14 modules standard of care diabetic foot. Objective of this program save the limbs because limbs are the life. Standard of medical care in diabetes 2022. Overall population health is defined as the health outcome of a group of individuals, including the distributions of health outcome with the group. These outcomes can be measured in terms of health outcomes, mortality, morbidity, health, and functional status, including disease burden, also included. Standard of medical care in diabetes 2020, glycemic control and control of cholesterol through dietary intake remain challenging. In 2013 to 2016, 64% of adults with diagnosed diabetes met individualized A1C target level. 70% achieved recommended blood pressure control. 57% met the LDL cholesterol target level. 85% were non-smokers. Only 23 met target for glycemic, blood pressure, and LDL cholesterol measures while also avoiding smoking. Chronic care model. The CCM includes six core elements to optimize the care of patients with chronic disease. First, delivery system design, moving from reactive to a proactive, and the delivery system and planned visit are coordinated through the team-based approach. Self-management support, decision support, clinical information, community resource and policies, and finally six, health system. The early recognition and appropriate management of neuropathy in the patient with diabetes uh, is important. Diabetic neuropathy is a diagnosis of the exclusion. Non-diabetic neuropathy may be present in patients with diabetes and may be treatable. Second, up to 50% diabetic patient peripheral neuropathy may be asymptomatic if recognized. If not recognized and if prevention foot care is not implemented, patients are at risk for injuries to their insensate feet. Recognition and the treatment of autonomic neuropathy may improve symptom, reduce sequelae, and improve quality of life. Diagnosis of diabetic peripheral neuropathy. Patient with type 1 diabetes for 5 or more year and all patient with type 2 diabetes should be assessed annually for DPN using the medical history and simple clinical test. The most common early symptoms are induced by the involvement of small fiber and include pain and dysphagia, unpleasant sensation of burning and tingling. Involvement of large fiber may cause numbness and loss of protective sensation. Uh, Loss of protective sensation indicate the presence of the distal sensory motor polyneuropathy and is the risk factor for the diabetic foot ulceration. Assessment recommendation. The following clinical tests may be used to assess small and large fiber function, the protective small fiber function, ping prick and the temperature sensation, large fiber function, vibration, perception, and 10 gram monofilament vibration sensation using at the 120 uh, tuning fork for the large fiber function, protective sensation 10 gram monofilament. Diabetic autonomic neuropathy. The symptom of the sign of autonomic neuropathy should be elucidated and the major clinical manifestation of diabetic autonomic neuropathy include hypoglycemia, unawareness, resting, tachycardia, orthostatic hypotension, gastroparesis, constipation, diarrhea, fecal erectile dysfunction, neurogenic bladder, and the pseudomotor dysfunction with either increased or decreased sweating. Cardiac autonomic neuropathy, advanced disease may associated with resting tachycardia more than 100 and the orthostatic hypotension, a fall in systolic or diastolic blood pressure by the greater 20 or 10 millimeter respectively upon standing without the appreciate the increased heart rate. Gastrointestinal neuropathy may involve an portion of the gastrointestinal tract with manifestation including esophageal dysmotility, gastroparesis, constipation, diarrhea, and fecal incontinence. Genitourinary disturbance, diabetic autonomic neuropathy may also cause genitourinary disturbance include sexual dysfunction and bladder dysfunction in men, mostly caused by the ED, erectile dysfunction, or retrograde ejaculation. Neuropathic pain can be severe and can impact quality of life, limit mobility, and contribute to depression and social dysfunction. Diabetic neuropathy uh, in large fiber neuropathy, small fiber neuropathy, proximal motor neuropathy, acute mononeuropathy, or entrapment. Neuropathic pain recommendation, pregabalin and the duloxetine have received regularly approved by the FDA, Health Canada, and European Medicine Agency for the treatment of neuropathic pain in diabetes. Duloxetine also appeared to improve neuropathic related quality of life. The risk of ulcer and the amputation is increased in people who have the following the risk factor: poor glycemic control, peripheral neuropathy with LOPS, cigarette smoking, foot deformities, pure ulcerative cellulose or cone, PAD, history of foot ulcer, amputation, visual impairment, chronic kidney disease. Foot care, American Diabetic Association recommended perform a comprehensive foot evaluation at the least annually to identify risk factor or ulcer and amputation. Patient with the evidence of sensory loss or prior ulceration amputation should have their feet inspected at every visit, obtain prior history of ulceration, amputation, charcot, foot angioplasty and the vascular surgery, cigarette smoking, retinopathy, and the renal disease, assess current symptom of neuropathy pain, burning, numbness, and the vascular disease, leg, fatigue, or education. The examination should be include inspection of skin, assessment of foot deformities, neurological assessment, 10-gram monofilament testing with at least one other assessment. Pointer of consider full tussar and the amputation, which are the consequence of the diabetic neuropathy and or the peripheral artery disease, are common and represent major cause of morbidity and mortality in people with diabetes. Early recognition and the treatment of patients with diabetes and fit at risk for ulcer and amputation can delay to prevent adverse outcome. The do's and don'ts for the diabetic foot care. Diabetic foot care of dogs, caring for your feet, uh, everyday monitoring, dryness, also include in this step. A step each day can help can problem at bay. Keep the blood pressure following at your feet Question: TCM standard for chronic care model. Question number two: up to 50% of diabetic peripheral neuropathy may be asymptomatic. Name of drug improving the quality of living associated with the neuropathic pain is duloxetine. Thank you.
Thank you so much, sir. ये हो गया सर